From the NMSU Department of Journalism and Media Studies in collaboration with KRWG, this is the student-produced News22, where news matters.
A growing healthcare crisis is unfolding in New Mexico.
That's right. The state faced a physician shortage fueled by concerns over malpractice claims and rising insurance costs. News22's Hernandez is here with more on this developing story.
Lawmakers and medical professionals are looking for a solution as they warn that patient care will continue to suffer without action.
All of you so very much for coming today.
New Mexico has long faced challenges in healthcare access, particularly in rural areas, but now an increasing number of physicians are leaving the state or retiring early. They blame rising malpractice insurance claims and legal concerns. They say the current system is unsustainable.
I've been trying to hire somebody in my place for about the last 3 years to do sleep medicine in Las Cruces because I've become too old and I couldn't find anyone because of the fact we've been losing physicians for a long period of time.
According to the New Mexico Medical Society, the state has lost a significant number of healthcare providers over the last few years. The patient-to-provider ratio is about 1,500 to 1, making it hard for patients to find a primary care provider and the proper care they need. That forces patients to travel hours out of state for basic medical care. Today I'm here at the New Mexico State Capitol where thousands have gathered to talk about important issues within legislation, one of the biggest being the loss of physicians and malpractice. A busload of doctors came here to lobby for Senate Bill 176. If passed, it would reform medical malpractice law by capping attorney fees and change how the Patient Compensation Fund pays out patients. The Patient Compensation Fund is a state-run system that provides medical malpractice liability coverage. It also provides money to compensate injured patients and to recruit and retain physicians in New Mexico.
So is it a good system? No, it's not. However, we need to find a solution to this that not only is attractive to doctors, but also takes care of patients.
The current bill would prioritize patient needs and safety in New Mexico by redirecting 75% of punitive damages towards improving health care. This funding will support better training for healthcare workers and increase staffing levels, aiming to reduce the risk of future malpractice incidents. But State Senator Carrie Hamlin says the problem is with insurance companies.
Because we have insurance companies that are charging doctors exorbitant premiums for their medical malpractice. But then we also have insurance companies who are not committing to taking care of people who have been victims of medical negligence.
She says that while there is no definitive solution at this time, ongoing discussions are necessary to find the best outcome for all parties involved. And doctors say if there's no change, the situation will get worse. Hernandez, News22. The bill is currently pending in the Health and Public Affairs Committee of the New Mexico State Senate. This legislative session is set to end on April 11th.
From the NMSU Department of Journalism and Media Studies in collaboration with KRWG, this is the student-produced News22, where news matters.